it is a delight to be here, and I'll back up just a little bit and say it's particularly delightful for a few reasons. One, I get to work with one of my favorite people, Brian Boyd. So I'm going to tell you a little bit about him so you'll know a little bit about him through the day. But Brian and I first met about, what, 8 years ago? And Brian, I was at the University of Florida, and Brian came as a doctoral student and worked with me there for a number of years. And then we developed a working relationship and a friendship. So it is the first person I thought of to help me do this workshop with Brian was Brian, because he is truly an expert in the field. So it's wonderful to have him here. He's an investigator at Frank Porter Graham Center at the University of North Carolina in Chapel Hill. And I'm a faculty member at Virginia Commonwealth University. I've only been there a short period of time. Corey Hill contacted me about, I think about 6 months ago, and talked to me about the possibility of doing this. And one of the reasons that I jumped on it was because I feel that oftentimes infants and toddlers and very young children who are just recently diagnosed with autism spectrum disorders may not always have coordinated services. It seems like once they get into school, we might have a little more coordination of services, but oftentimes a diagnosis is happening as they're being served, and we're trying to figure out what are the best things we can do to help provide the services for these young children and their families. And there aren't a lot of in-service trainings or workshops out there. There certainly have been some packaged curricula, and there's some packaged programming. But what we hope to do today was take bits and pieces of what we feel are best practices to teach families about how to start early social interactions with their children and help develop adaptive behavior skills. It's an advanced workshop. We have a lot of information. You can tell the handout, you're going to have to get a, I think they had to get a forklift to bring the handouts in today because they're so thick. But there's a lot of information that we're going to share. So we're going to move pretty rapidly through the day. We've got a little bit of activity that we're going to do at our tables, but a lot of it is going to be just didactic, because we wanted to make sure that when you left here at the end of the day, you had information to take home with you that you can actually hopefully start using tomorrow. Those of you who are community practice leaders get to stick around another day and spend that with Brian and I, and then Abigail Vo, who's in the back of the room, who's a doctoral student at Virginia Commonwealth University and who's an expert in communities of practice, as much as any of us are, because that's an evolving concept, is going to help with that, as well as the entire committee. And before I start into the presentation, I do want to take a minute to thank Corey Hill, who has worked very hard in putting this together, and the entire committee. It's been a delight to work with everyone, and we hope that today, if you walk away with just 2 or 3 new things you learned today, then I always feel that that's a successful workshop. But hopefully you walk away with a lot more than that. So this is a big technology challenge for me today, so hopefully we're going to run smoothly. Hey, first slide worked. So I'm going to just briefly go through just some basic facts. I think we probably, I would say if you're here, you probably have had experience working with young children with autism, but we all know that every day in the paper or every, day on the news, we hear about this increasing prevalence, and I'm sure everyone is asking you, why? Why are children with autism being diagnosed more than they were when I was that, 20 years ago or 30 years ago? I think there's a multitude of factors that we could, spend time talking about over lunch, but the thing we can all agree on is we are seeing more and more children ending up with a diagnosis of autism spectrum disorders, pervasive developmental disorders, and the diagnoses aren't always so clear-cut at this young age. We just know that these children have characteristics of social and communication and behavioral needs. There are model programs out there. We provided some resources for that. Brian and I don't run a model program. What we tried to do is take bits and pieces from model programs that if a child's not in a model program, then let's take the best of those model programs and put them into an in-service workshop training. But there are some model programs, and And we provided the resources for you in your handout on those. These are children who have sensory processing problems. They have trouble interacting with their environment. Things like lights, noise, a lot of activity can really interfere with these children's ability to process information. They have trouble motor planning. They don't always, walk the same way or get around the same way. They might have fine motor difficulties. They have trouble regulating their emotions and arousal. So as we were saying, and Brian's going to talk a lot about, or this afternoon, about sensory difficulties, and so oftentimes they have behavior problems, and that can be difficult for families and just behavioral organization. So children with autism have unique characteristics, but they also are young children with special needs that are not necessarily all the same. So what you'll hear throughout the day is one size fits all. We can develop a model program, but it won't necessarily meet the needs of every child you interact with. And so I think the challenge, and what we hope to talk about today, is how you individualize that and how you work with families to make sure that intervention is embedded within their natural family routine and their environment. But all of the difficulties that I just described will result in problems with social interactions with adults, and as they grow older, with peers. They also will have difficulties with verbal and nonverbal communication, and then they have what we call restricted, repetitive, stereotypical patterns of behavior and interests. And that is something that I think is a common core characteristic of young children with autism, is repetitive behaviors or restricted interests. So what we want to focus on is teaching social communicative behaviors, and that is one of the, I think, when I look at a young child, an infant, a toddler, or early preschooler, and that's mostly the age level we're going to focus on today, building their social communicative skills is a pivotal place to start. And that's the hardest place to start, because as young children develop, that's almost a natural reciprocal interaction with their parents. And so, a child looks at a parent coos, the child smiles, and that becomes a normal routine. But that natural reciprocal interaction breaks down a little bit with children who have deficits in that area. And so that is the area that we want to focus on today in the morning, is really looking at how you build early social communication skills. The lack of social communication skills, and tell me if you all agree, provides a lot of stress for families. That's where I see families say, I don't know what to do. What I would normally do doesn't seem to be working for me and my child. So what we hope to do today is teach you some strategies that might get those patterns onto a more typical way that parents can interact with their children. I want to mention a little bit about service delivery challenges, because I think that is the emphasis behind communities of practice. Service delivery is hard for autism, because we have a lot of different literature out there talking about the types of services that are the best services for children with autism. And it's always hard to provide those services across a community. How do you do that? How do you serve every child's and family's needs? And yet, within the early intervention community, we have a service delivery model, and I think at times that might be at odds with what's out there in the literature saying it's a best practice or a recommended practice. So let's talk just a few minutes about that, and as we go through the day, think about your service delivery model and how you provide services to families, and how you can make that model blended with providing a community of practice model. So one of the challenges is just providing enough services so that the children and their families feel like they're getting their needs met. And since these children have a number of needs, the services are oftentimes needing to be a little more intensive than what early intervention services are typically programmed around. And so I think that's a challenge that we'll have to talk about as you work in your communities of practice and say, how do we provide services that meet the needs of the family and the child, but are also best practice? And I think that there has to be a continuum of services. Some families need more services than other families. Some children need more services than other children. So when we look at the providing a service, you know, it could be that it's every other week for this family and maybe 2 or 3 times a week for that family until they're able to learn some skills and become more independent in their skills. So think of service delivery as a continuum and based on intensity of needs. But we always, as early interventionists, have the conflict of there's never enough services or time to do what we need to do. Unfortunately, I don't have the solution for that other than to recognize it and try to, you know, within your communities of practice, find a continuum that's kind of sliding based on families' needs. And then the idea of one size does not fit all. That this is an important concept because we will have people out there that say, oh, I have a child with autism, we have to do this. Or I have a child with autism and this is the strategy that we have to use. And I don't know that there is one strategy. When I think about the children with autism that I've worked with and I've watched them grow over the years, what they might need at age 1 or 2 is totally different than at first grade. Brian and I were talking about a friend of ours who has a young girl with PDD, ASD, and as a young child, she was self-injurious, she engaged in a lot of repetitive behavior, and she was what I would call a pretty difficult little girl. Very bright little girl, though. Well, I was talking to our friend the other day, and she went to kindergarten last year and did very well, and she entered first grade this year, and the school wants to put her in a 3rd grade classroom because she's reading so well. And, you know, I would have never placed her at that point you know, when she went into first grade if I was just looking at her skills when she was 1.5 and 2 years old when we met her. But this was a family that put her in an inclusive preschool program and just helped facilitate her growth. And she really had no intensive behavioral interventions. She had a family that worked with her to develop reciprocity. And so, you know, my point being is that children change over time, families' needs change over time, and services need to change over time. And one size definitely does not fit all for this population. And what we might think we need at age 1 or 2 can be totally different at age 5 or 6. So she's doing well, and that's so reinforcing when you watch these children grow up. So what we're going to do today is provide an overview of different practices that you can work with families to teach them to deal with problems. And the committee talked about how to do this, and we've broken these practices down just into really 4 practices, and then Brian's going to talk about how you embed them throughout the day and how you evaluate them. Evaluation's very important in the field of autism in this day and age. You know, as I work with school districts, and many of them are looking at how they evaluate their services, the more evaluation we can do of the success that our instruction to families, the outcomes and the success that happens with children, the better off we are. Then we can show families the positive outcomes that have come from working with their child and us working with them. So evaluation will be an important piece of today, but we're going to cover some scientifically based practices that have research behind them, and we're going to do it under the framework of more of a contemporary behavioral approach. I am a behaviorist, and I'm proud to be a behaviorist. You don't find many early childhood people that are also behaviorists. But I think when we talk about behavioral interventions, there's a continuum, and there's more of a contemporary approach of behavioral intervention. And the philosophy behind what we're talking about is really more of a contemporary approach. Day 2 is building communities of practice. So I just want to introduce that terminology. That is the focus of this conference, and we will be working on that with the community of practice leaders during Day 2. And so as the rest of you go back to your communities, I think those leaders will be contacting you and helping build that concept within your own communities. So, as I mentioned, these are the topics that we're going to go over today. We're going to, I have a little laser pointer, so it's fun technology up here. But of course, now I can't find it on the board. Okay, I need to stop playing with my technology. See, this is when I get into trouble, as I start trying new little things. Anyway, okay, so I'm going to talk about early social communication skills. And I'm going to talk about replacing socially mediated challenging behaviors. And then Brian's going to talk about sensory maintained behaviors and then natural intervention and assessment strategies. The contemporary approach that I'm talking about, and this is just to help you get conceptually where we're coming from, is the traditional early intervention model is very family-centered. We're going into people's homes. We're working a couple hours a week with someone. It's natural environments. It's inclusive environments. It's disciplinary. And this is how I was trained, and I'm sure many of you were trained to be early interventionists. And then you have this kind of autism model that's evolved, and it's more intensive behavioral intervention, 25 hours a week, one-on-one, adult-directed. So that's a model that's out there, and the reason why I bring this up is because it's one of the first models parents come into contact with. Oh my gosh, applied behavior analysis has been successful with children with autism. And I think the challenge in service delivery is how you blend these two models. And that's what we're trying to do today. There is a more contemporary way of looking at ABA services. And it hasn't had a lot of research, but there is a research base to that. And it's blending applied behavior analysis strategies with early intervention strategies. So you implement those in a natural setting. You follow the child's lead as you're doing that. You teach the parents how to do that. And it's not a pull-out model. And it's very successful, and it's evidence-based, and it's scientifically based. It's not as packaged a model as the ABA model has been. So if you're out there and you run into parents, this is just that would like 25 hours a week of intensive behavioral intervention. This is a way to help educate them that there are other strategies that are built based on evidence. And we could spend all day talking about that, but I wanted to really just get that out there so you could understand where we're coming from, and if you have more questions about bridging that gap, I'd be happy to talk more about it. But what we really want to stress is using positive and preventive behavioral strategies that build predictable and kind of responsive behaviors throughout the day when parents are working with their children. And that part of it is collaborating with family members so that we can really be family-centered in providing those behavioral intervention strategies. And within your communities of practice, looking at maybe monthly parent groups so that parents can get together and make some comparisons about what's working with them, and parents can talk about the strategies that have been successful and share those strategies. So the contemporary approach is it's still applied behavior analysis, but it embeds that early intervention within an applied behavior analysis framework. So really our overall goal from a service delivery standpoint is to support family members in feeling and being competent and confident about their abilities to enhance their child's development. As an early interventionist, I can't be there 25 hours a week working with a child, so my goal and my job is to work with a family so that they learn the skills that they need to learn to feel confident and competent about working with their child, and that we really want outcomes for children. By focusing on developing positive outcomes for children, we know that those children are learning, and by measuring those outcomes, we can show family members that their children are gaining skills. There also is research and literature to say that parents can be interventionists, and in fact, they're some of the best interventionists that you can have when working with young children. So we want to focus on that. We want to teach parents to be interventionists with their children. And there has been a number of studies that say parents can learn different strategies. And that when parents are interventionists, we actually get better generalization and maintenance of skills. We also, the children make more gains overall when their family members are interventionists. It improves the quality of the family's life. That builds their confidence in feeling like that they really can work with their child and they can interact with their child. And it just builds their self-efficacy. And for those of you who are worried about funding, which I never am, but I think some people who have administrative positions need to be, it's actually cost effective too. So having parents be an interventionist for their child is an effective way of delivering services to this population. How do we teach parents? That's always a difficult strategy, but we know that modeling is a good way of teaching parents. Brian and I are going to do some modeling and kind of role playing today, just little snippets of it, providing written explanations. One of the things I've learned from being a faculty member is I can tell someone to do something, but if I put it in writing, my message is a lot clearer. And if I put it in very simple writing and leave it with that person, it's even clearer. So modeling, showing somebody how to do it, writing written explanations, role playing, and observing the person doing it and providing feedback. So as you work with families, keep these 4 points in mind, that if you want to teach a family member a skill, it's rather than just saying do this, actually walking through these 4 points will help facilitate that person's skill acquisition. So before we get into joint attention, which is our first social communication skill, communities of practice, professionals still have expertise. Family members can be experts as well, but professionals are experts. You guys are all experts. Brian and I are doing this workshop today, but probably a number of you could get up here and talk about many of the things we're talking about because you've had training and expert skills in these areas. The communities of practice are there to build kind of from the grassroots up, to build, opportunities for professionals to just expand their educational and therapeutic skills, to come together and problem solve over issues. And so communities of practice are there sort of as a resource, and they're an evolving concept in early intervention. And in fact, I think Virginia is taking a lead in this area that I don't know of any other states taking a lead in. So as we go through the day, think about that you will have additional supports back in your communities to help build and problem solve. How do I teach parents to do this? Well, let's problem solve back in our community. How do I work on joint attention skills? Let's problem solve. How do I deal with problem behaviors with children? Let's problem solve back in our communities of practice, and those will be a resource for you after you leave today. So the goals of our workshop is really to provide participants with training and expertise in scientifically based practices, And those are based around increasing social communicative behaviors and then decreasing challenging behaviors, and set the stage for developing communities of practice in Virginia. Okay. Increasing social communicative competence. Anytime you work with children who have problem behaviors, the first place to start is to build positive behaviors, because we never decrease a behavior without increasing appropriate behaviors. And usually we're having problem behaviors because we don't know what to do. So, you know, if I had a technology meltdown here, I would know to raise my hand and ask for assistance. But if I didn't know how to do that, in fact, Brian said, I think I'll just fall on the floor and have a tantrum. And you know, that would get attention pretty quick. So not knowing how to do what to do is usually the reason why we have challenging behaviors. So this first part of this morning is focusing on building social communicative behaviors, because that's where we want to start. We want to build positive behaviors. And I decided to focus on two main ones. That's joint attention and socially oriented towards someone, and then imitation and early communication skills, because those are foundational skills. And joint attention is something we talk a lot about, but we don't always teach. It's hard to teach joint attention, and yet we all know when it happens. So I'm going to present strategies for each of those, and then if we have time, we're going to do a little just small group practice. But I'd rather get the content out there, and then, you know, you can have homework to practice within your communities of practice. So, so what's social communicative competence? How do you know somebody is socially competent? How do you know someone's not socially competent? They're doing something that's unusual, right? How about someone who, well, I had an attorney talk to me on Friday, and he was wondering if this individual had autism. And he said, well, the person came up to me, stuck out his hand and said, hi, my name is so-and-so. And he said, so he seemed pretty socially competent to me. Well, I don't know, you know, it depends. Did he look at him? Was he just trained to do that? If the attorney asked him a question, could he actually follow through with that? We seem to know when somebody is socially competent and when they're not. But there's definitions, but there isn't really a good kind of, you know, there isn't, it's a concept. And so it's a little bit different than knowing if somebody makes eye contact.